Before the break, we had a question from Susan who wanted to know if crossing your legs cause varicose veins. We've all heard this one before, right?
Everybody's uncrossing their legs, right?
And we're going to tell you what causes unsightly veins in just a minute. But first, Susan is back in our procedure room. She's here for a new vein removal procedure with dermatologist Dr. Sandra Lee and our very own Dr. Orden. So,
how are you? So just some background information, problems of the veins. The problem depends on the size of the veins. Larger veins, you're more likely to see varicosities, so-called varicose veins. Not related to crossing your legs. That's more a hereditary condition. What can aggravate varicose veins? Carrying extra weight, pregnancy, staying on your feet for a long time.
Heredity. I mean, just being female too.
Heredity.
Or passing it on. Yeah.
Okay, so then we move down to the medium and smaller size veins, spider veins, reticular veins.
Yes.
I know that you like to use that term.
Yes.
That, in fact, may be related to crossing your legs.
Yes.
So the answer, Susan, is yes. And what you're going to do, Dr. Lee, you're going to show us how you can treat some of those medium-sized spider or reticular veins.
This is called sclerotherapy, and it's really been around for decades. It's the gold standard in which to treat leg veins. But what we're going to do is something a little different. We're going to use polydocanol, which is a detergent, which we commonly use, but we're going to foam it. This is an advanced move. The reason we foam it is it actually will stick into the vein better, stick to the walls of the vein, and stay contained in that area. Sorry, I'm going to put my helmet on.
Okay.
I think my husband proposed to me with this helmet because I look really sexy.
Did he?
Let's see.
That's a look.
So we use a really tiny needle, and we actually go right into the vein and inject this sclerostin. I use this because it's polarized. It's actually really cool. When I turn this knob, I can see the vein really well.
Is there local mixed in with this?
No, there's no local mixed into this. No, it doesn't really. It's not really uncomfortable.
Because it's such a tiny needle.
Yes, it's very, very
You've got
small.
to see this. This is so cool.
If I can get it to the vein properly. There you go.
You see that?
And you just see it'll slowly. If you keep watching, it'll slowly disappear. We'll do another one right here. And this is permanent. Yeah. This is permanent. You can have them treated again, obviously, if you get new ones. You can see if I keep doing it, see how the whole thing is just disappearing before our eyes? Very cool. But I will tell you this is a wintertime kind of treatment because they will initially look worse before they look better.
That is a huge improvement.
Yeah,
I mean, this whole area in there.
Right?
There you're gone.
Yeah, so it's really a nice treatment. It's easy to do. Sometimes it takes a couple of treatments, but what is very important is that she wears compression hose, these lovely hose afterwards, because we want to keep them nice and tight and kind of closed down so that they absorb.
And do you get the same effect with dark skin as you do with light skin?
Yes, yes, absolutely, absolutely.
And Dr. Lee, do we need to tell Susan not to cross her legs?
Yes, but it's hard. You got to live your life.
A little bit.